that's happening at 11:30 to 12:10 right here at the founder stage, how emerging markets will reshape the future global economy. All right, so we're about to start very, very shortly. And of course, we've got our panelists right here. We've got Ahmad Shah Nizam, General Partner at Xeraya Capital. He will be moderating. And of course, we've got Tiffany Khoo, co-founder and CEO at WeAssist. Got Dr. Ezam, wow, you look as good as your photo, yeah? Dr. Ezam Mat Ali, founder and CEO of MedPlanner. Zahir, co-founder and CEO of Xeraya Capital. All right, Ahmad Shanizam, you can take it away. We're going to start right now. I think our group's here. For those that want to join us, do just join us here at the seating.
Bismillahirrahmanirrahim. Thank you very much. First and foremost, a very good morning and very happy to see so many of you turning out today. We hope that we have a very exciting and interactive panel discussion this morning. And I think this is one of the things that I felt that for KL20 is significantly value adding in the sense that this whole concept of the founders stage and showcasing companies and players in their various verticals is actually a very good approach to broadening out the familiarity with the sector. I don't want to take too much time because I think there's a lot of things that we want to discuss and unpack. So before we start, I think perhaps I'm going to get each and every one of my panelists to give a brief introduction as to what they and their organization do, so that we give a bit of context, and then we can start on some of the topics that have been prepared for this morning. So perhaps ladies first, Tiffany.
Hi, good morning. My name is Tiffany. I am the founder and CEO of WeAssist. And what we do is that we help hospitals and clinics look for part-time medical staff, such as nurses and doctors, to fill in those locum shifts.
Hello, everyone. My name is Dr. Ezam Mat Ali. I'm a clinical doctor, but after 20 years, I've stopped working because I want to concentrate on MedPlanner, which is an app that solves healthcare communications, because 60% of healthcare issues, that bad things that happen to patients, can be traced back to problems in communication.
Hello, hi. Morning, my name is Zahir. A little bit about myself. I'm an actuary and a financial analyst by training, although more of an investor by trade. Been in the area of investments for about 3 decades, about 30 years, with a few different organizations. Was a fund manager with Schroders, joined UBS, and then Khazanah, and Xeraya Capital was essentially spun out of Khazanah. A bit about Xeraya, what we do is we invest in life sciences companies. And life sciences for us is a bit more than healthcare. So this forum itself is on health tech, but we invest in, so healthcare would be med devices, would be pharma, but also in the area of ag tech as well as renewables. So it's a broader thing. We have a playbook where we seek opportunities globally, and we try to add value on what we know about Southeast Asia, or Malaysia in particular. Maybe just a little bit about Xeraya itself. We've invested 30 companies over the last maybe about a decade or so. Of that, we've got 3 companies, 11 companies that we've exited from. That's IPO as well as been taken over. 3 of them unicorn. I think there's mention of unicorn, all that our investors like to hear that, although there's many different type of animals these days. And 6 of those reached a unicorn level, but with the market being where they are, they've come off to become a different animal. So that's us.
Thank you, Faris. So there you have it. It's a very diverse panel, and I think it was deliberately curated so that we are able to actually have a very broad discussion, but therein also lies a challenge. But I think it's useful to note, and I think this is something that I think the organizers have done quite well, to actually try to really showcase the capabilities from within Malaysia, but also what we can do beyond. And I think that's going to be one of the key topics that we want to sort of touch on today. But before we go into that, this is actually a general question that I would like to just pose to the panel. Health tech, or in the healthcare space, there's actually a very broad and a very large sector. It goes all the way from services right down to pharmaceuticals, medtech, and so on. from the perspective of each of your organizations, what do you see the best opportunities for health tech in Malaysia, but also perhaps broadly in the region and beyond? And how do you see what your proposition would bring to that ecosystem? Perhaps we can start with Tiffany.
So the honored position of being able to start and explain. When we look at the opportunities here, so what we mainly work in is trying to help fulfill manpower needs that hospitals face. And we hear so often that this is a supply problem, that there's not enough nurses and not enough doctors. But the reality is that, yes, supply is kind of one issue, but another big problem here is that there's an inefficiency issue. If you speak to nurses and you speak to doctors, sometimes they will tell you, oh, I'm not seeing any patients, oh, I don't have any shifts, I don't have any slots. So clearly we can see here that it's a big, big efficiency problem. And this is also global. Right now, Malaysia, all our nurses, they say, get exported out. So our nurses end up going to Singapore, end up going to Australia. But in Singapore themselves, their nurses are going to the UK. We are taking Thai nurses. Philippines is taking Indonesian nurses. We are basically sharing resources amongst the region. And clearly it shows that maybe supply isn't really the problem. Maybe it's really about just kind of matching the need that everyone really has. So that's what I see as being this great opportunity, but also a problem that we can solve in this space.
And how does technology or digitalization facilitate that?
So now that we know that there is this problem, technology itself is a great tool for efficiency. One of the ways that we can immediately do that and fix that is to credential everyone in one place, which is what we do. You know, you have a standard credentialing measure. Everyone's profile, everyone's, just like how you have a passport and you can go into different places. I can see a future where even us as professionals will be able to have all our details on kind of one interface, and that enables us to work wherever we want, whenever we want. Yeah.
Great. Thank you, Tiffany. Dr. Ezam, your thoughts?
So, in my view, the biggest opportunity for health tech in terms of how we address the issues in healthcare is where we can use health tech innovation to blend it and match it with critical health needs. So what are the critical health needs? So critical health needs, if you look at World Health Organization reports, Malaysia's Ministry of Health report, is to do with the burden of non-communicable diseases. So what are non-communicable diseases? Non-communicable diseases are diseases such as diabetes. Do you know that 1/3 of Malaysians have diabetes? Do you know that almost half of Malaysians have high blood pressure? And there's a huge burden on heart attacks, myocardial infarction, and cancer is the second biggest killer. So these are the critical health needs. But how does health tech innovation help with meeting these critical health needs? Okay? There are various ways. So if you ask me in terms of MedPlanner what we do, we have studied this space and we look at high-level solutions. So this is what MedPlanner is doing. We look at high-level solutions that we have studied and over the period of 5 to 6 years. The study started from London as part of London Digital Health think tank. So I came back here to Malaysia where we built a solution. It's a clinical messaging app where there's a messaging engine that we use to help with the clinical flow in meeting these healthcare needs. So I'll give you examples. So patients with diabetes, they are usually looked after by multiple teams. It could be a team of renal physicians. They may have kidney problems. It could be a cardiology team looking after their heart. It could be an eye team, ophthalmology, looking after their eyes. But where is the common information? Okay, some hospitals, some clinics have electronic health records, some don't. What about the patients? They can go through one facility to another. But how do the healthcare professionals communicate with each other? So with MedPlanner clinical messaging app, clinicians can actually message each other, they can communicate with each other with the patient at the center of the system. So imagine you're using WhatsApp, you have, say you are a team of cardiologists, all right? And you have 5 patients, but you cannot discuss these 5 patients without getting confused and scroll. But with MedPlanner, you have channels for each patient. So each discussion or management plan for that patient can happen much faster. In the same way, if different teams want to talk about that patient, so like I mentioned just now, diabetes, renal, and the rest about the same patient, there is an inter-team messaging capability. Okay? So this is how I see at high level where in MedPlanner we're looking at the opportunity for meeting critical health needs. But of course there are a lot of other solutions, but this is an example of a high-level solution.
Understand. Thank you. So I think, in short, the solution that you have is actually bringing back the centricity or patient-focused care, because it actually is not around the providers, but actually around the patient.
Correct.
Okay, that's great. So perhaps we can zoom out a bit and maybe ask Faris his perspective in terms of the opportunities, but also what you've seen. And I think in your situation, you've actually been also very global in terms of looking at the opportunities. So how do you see this?
Yeah, thank you. So it will be looking out a bit, because I think 2 panelists were talking about the companies itself. When we look at health tech, firstly, it's exciting in the sense that it's the confluence of technologies that's happening in different areas. So the first is in the sciences. There's a lot of advancements in the sciences and life sciences, which I'll talk to in a bit, like gene editing and amongst others. The other is whether it's digital itself. Technology would be, I guess AI would come to the fore. Engineering, computational math. So there's all these things happening at the same time, exponentially in terms of the improvements. And because it's interlinked, when we're talking about health tech itself, I think it holds a lot of promise and great opportunities. So that's kind of how we look at health tech, is a combination of the life sciences and, say, AI. I thought I'd mention a few of the companies that we've invested in, just to get a flair for that. So one was a company that looked at the patterns of glycoproteins within the blood itself, and you run a spectrometer, and you need to use an AI to get a sense of the biomarker of what is it? Is it cancerous? Where's the biomarker? Because without AI, because the thing just keeps on moving, it's very difficult for you to decipher and ascertain what exactly is the biomarker to that. So that's quite an exciting opportunity that we invested in. We have somebody in the Zahir in the crowd that was involved in that company. And so that's one. And the other is looking at genomics as well as AI, and trying to ascertain, because now it's cheaper to sequence the human, the genome and all that, and you can try and determine whether somebody is predisposed to a particular disease, and that can be useful in terms of, how you take care, whether it's therapies and so forth. The other things that I thought I'd mention, I mentioned a bit about gene editing, but I'll touch on that maybe a bit later. One is on the RNA platform, and how AI also is featured into that now. The platform itself, I think, has been known since COVID, because you have a platform that essentially, if you are able to sequence something, so able to sequence the virus or the COVID virus, you're able to also design a vaccine very quickly. You're able to design a vaccine that trains your immune system to attack the spike protein of that virus. And that's essentially how the vaccine was able to be designed and approved within 100 days itself, which is unheard of, because typically it takes 10 years to do vaccine. So we have a company that also has that RNA platform, although they're focusing on the ag side, but they are also using AI on the back of that to try and make it even quicker to come up with a solution to address that. Gene editing, I thought I'd mention that as well, because I think in the 2010s or thereabouts, when they were discovered by a few people, they held a lot of promise, right? Because you could not only sequence the gene itself, but you could edit it. But it was as recent as December of last year where we had a collaboration of two companies, CRISPR Therapeutics and Vertex Pharmaceuticals, that managed to get a gene editing therapy approved. So that came from one of the founders of CRISPR itself. So what it is, it's a therapy on a genetic blood disorder. It's a single therapy. It's very expensive, runs into the hundreds of thousands of dollars. I think we'll know about that. But it's a single therapy because essentially you take take the bone marrow, you edit it, you put it back, and essentially your whole body generates that gene and it solves that, And there's a few companies that's coming out with other therapies in the pipeline, so we have other companies as well. The point on that is that, so you have these companies that have Nobel laureate type people that are founding the companies and coming out with these gene therapies. But the opportunities also arise because the cost of sequencing the genome has become cheaper. So you could actually think about finding a solution, a genomic solution with what we have today to see how it can be useful to those companies. So those are the four that I thought I just mentioned.
Wow. I'm just getting sort of it's really zooming out because as you can see, the space is so broad. You've got genetics, gene therapy, AI, life sciences, biotechnology, and I think this is the interesting part about the health tech space. There's so many opportunities, and I suppose a follow-on question for Faris, but to tee it up for the rest of the panel as well. How do you see the ability to connect between all this frontier, leading-edge work that people are doing in terms of gene therapy, utilizing artificial intelligence, and so on, in terms of actual solutions, products that actually are ready and can be brought to market? Because I think quite often we see there's a certain disconnect. And where do you see this opportunity lie? And perhaps the same question to the other two panelists on that point. How do you see a lot of this leading technology being applied to your current solutions? Faris?
Right, okay, so I mentioned four just now. So with those four companies, maybe the first one was looking at, say, glycoproteins with AI. So effectively, where can it be useful? Because if you can detect something before it becomes cancerous, that'll be wonderful, right? And if it's from glycoproteins, it's basically from the blood. It makes it easier because it's less invasive, somewhat of invasive because you have to draw some blood. And if you're able to identify if you have something there that before it becomes cancerous, you're able to detect it, then that's helpful. So there is a market for that. I think the company itself is working on colon cancer. And there are parties out there that's looking or already has a market. I think it's in the $1 billion kind of market, but they're using stool samples. So there's you have stool samples and it has some advantages there, but using blood, drawing blood in achieving the same thing can just be as effective, and you can create a business out of it.
So you're saying that some of these technologies are already quite readily adaptable for actual solutions and products that are in demand?
Yes, they are. That particular one, yes. Well, that particular one, they're working towards it becoming, getting there. Sometime this year probably would be the target.
And perhaps maybe Ezam, if you want to take that same question.
Yes, so there will be a lot of solutions out there and great solutions coming out in terms of gene therapies and so on. Some of them may be expensive, but over time they get cheaper. But the real problems, the way I see it, is in these three areas when it comes to clinical adoption. Okay? The first one is you need to see whether it's solving real problems. Okay? And I'll come back to that. Second, is it acceptable for the doctors or patients to receive that treatment? Okay? And third, is it replacing a better solution that is currently available? Okay? So the first one, is it solving real problems? It could be a treatment it works, but actually the treatment effect is only marginally better than what's already available. Okay? So for example, if a patient has a certain type of cancer, all right, and there are treatments like nowadays coming up called biologics, all right? And say if you want to use something like gene therapy, but gene therapy might be very expensive and it might have higher side effect profiles. So then why not use biologics, which are already readily available? So I'm just giving an example. These are the kind of things that when you have a solutions, you need to reflect on to what's already out there.
Maybe a specific leading question. Faris mentioned artificial intelligence. And I think for both WeAssist and MedPlanner, because you are working with people who are in the medical space, where do you see, for instance, some of these developments? There's a lot of talk. Yesterday, there were very good sessions here on AI. Where do you see and how realistic is that to be something that can be incorporated into what you are doing currently?
Okay, excellent question, because in the end, it's the healthcare community that moderate patient's care, that decides on patient care. So pharmaceutical companies, solutions out there, in the end, needs to get to the doctors and the healthcare community and their organizations first. Okay, so they make their decisions. Patients may Google and find out about certain things, but they don't have the overall knowledge about research methodology, side effects, so very important. So for example, if the solution providers and the doctors using a collaborative platform like our MedPlanner messaging app, they can decide and discuss about all these different solutions for the different problems such as cancer, diabetes, and so on, to decide on the best treatment decisions. So AI is a great example of how actually AI does not replace doctors. AI is a wonderful tool to assist physicians to get to the decision points. But doctors still need to decide and see whether it's relevant to the patient.
So human intervention is still very important at the end of the day, but it's enabled and supported by AI. Perhaps, Tiffany, you want also to take along those lines.
So I am kind of thinking of this within two contexts here. So one being obviously the more clinical angle that Ezam and Faris were talking about. And when you have better intervention or you have development in clinical outcomes, that means that a patient in a lived experience or perspective, a patient should hopefully be trying fewer different alternatives before they come to the final point of treatment or being well treated. And when you can speed up the time a patient takes to get better, what we're really looking at here is efficiency. So when I kind of zoom back out and think from a management or from a hospital management perspective or from any kind of management perspective, what everyone is trying to do is trying to figure out how with less resources can we get a better outcome. You know, and AI is a great tool to be able to do that because it helps you, like you mentioned, filter out certain prospects. You help calculate exactly how much resource is required in order to achieve a certain thing. And what we see more of in a trend is, I would say, virtual wards, which is where you're looking away from getting treated in a physical hospital or physical premises, but being able to get a lot of your treatment at the comfort of home or at least somewhere that's a bit more convenient to you. And when technology and AI kind of develops with that, you can calculate, you know, how many people are actually needed in the hospital. Maybe not as many as you think. Maybe the burden isn't as high as people think. And then obviously costs come down, people get treated faster, and you're on your way to early intervention.
Great. So I think you can see that actually there's a very much more deeper sort of approach than really just what people generally conventionally think. But I think the time is coming very soon that this is going to be quite widespread. Perhaps we can pivot a bit in our conversation this morning. I'm mindful that we are also in the founders stage. And I wanted to just perhaps also talk a bit about your respective experiences as founders in the health tech sector, not just in Malaysia, but also broadly. So perhaps again, starting with Tiffany, I noticed that actually WeAssist actually has been quite unique as a startup, that you were able to generate revenues fairly quickly on. And you were able to sort of get traction in the market. which is quite often a struggle for a lot of startups. Perhaps you can share with us a bit about that experience. And the other challenge, I think, in Malaysia at least, is actually quite often you are looking at this dichotomy between the public and private sort of providers. And I think in your case, you focus initially with the private providers. Is there something that the government in Malaysia, because they are quite supportive in a lot of these initiatives, and there's a lot of talk about digitalizing healthcare under the Ministry of Health, where do you see the opportunities?
Thank you for these questions. So for WeAssist journey, we've been around since May 2020, and we've been profitable month on month since 2022. And that is by no accident. It was a very deliberate decision that we wanted to scale at a stage in which we felt we could control the process. So a marketplace like ours is always a demand and supply sort of angle. You cannot keep generating demand if you don't have the supply. And if you have too much supply without equivalent number of demand, you basically end up with people who are very dissatisfied and don't have work. So that was a very deliberate thing. We would actually calculate how many people in sort of an area that will be focused on. But also we shifted our mindset. So my father is a doctor. He is very conservative, the doctor mindset. But also at the same time, he's an entrepreneur. So that kind of perspective that he shared with us was always about trying to grow, but at the same time, having your foot very well grounded. And that mindset made my team very well aware that although all the other startups were saying growth at all costs, we were fully focused on also the bottom line. And I think that laser vision kind of helped us as well. Yeah, but from the second question about the government side, what we truly believe is that people are no longer going to work the way they have worked. The people that are leaving the medical profession are leaving it because they feel that their lives are no longer in control anymore. After COVID, people have changed. They want more flexibility. They want to be able to choose when and how they work. And this is a trend that is going to change completely the way all of us work. So the government already restricts working for up to 45 hours a week. So that's already a limitation. But can you imagine if you could choose when those 45 hours were? Would you not have more flexibility? Would you not have a higher quality of life? And would you not be more inclined to stay within a difficult profession? I think the answer is yes. And I think the government, if they are able to extend these kind of options that we do with the private sector to perhaps the public sector as well, hopefully they will see more retention and hopefully see more satisfaction with the workforce.
Thank you, Tiffany. And perhaps to Ezam, just building on that. Again, MedPlanner is fairly early. You've got a product out, but it's currently about to be rolled out, from what I understand. And this is, in a way, a productivity tool as one way of looking at it, but also very specific and very focused on the healthcare space. Perhaps a bit of elaboration in terms of how you see the journey for MedPlanner going forward, beyond sort of trying to find your product market fit and getting to that, the MVP proposition. And where do you see this coming along over the next couple of months?
Thank you. So MedPlanner app solves problems with healthcare communication. You'll be wondering, what are the problems in healthcare communication? What is he talking about? But if you yourself have been in hospitals seeking medical advice or medical help, or your family members have had conditions in hospitals, you may or not realize that there are problems with healthcare communication. You'll realize if something bad happens. But we in the healthcare space, we know things could be better. Why aren't things better? I'll tell you why. Because at the moment, Malaysia and Southeast Asia does not have a solution for clinical messaging. In the US, in the UK, in Europe, they have dedicated clinical messaging apps that's been designed for doctors and nurses to communicate effectively for daily patient management. For example, if a patient needs to be transferred to another hospital, if a patient needs to be transferred to another clinical team, if the patient needs to be discharged home and come back to the hospital or being looked after in the clinic, if patients needs to be referred from clinic to hospitals, if a patient moves from one place to another, these are all what we call fragmented healthcare information. And this poses a huge issues. If you have diabetes and you've been on certain treatment, if you have cancer and you've been on certain treatments, the other doctors may start you on the same treatment and not knowing that you have had side effects and so on. In America and UK, they have looked at these issues where they can show that a lot of death and disabilities happened as the problem coming from breakdown in communication. So this is why we built MedPlanner, yeah? And you mentioned about MVP just now. So the early MVP, I architected it in the UK, and we've shown 700% increase in productivity and efficiency and revenue. So for example, over a period of 4 months, the doctors were able to look at complicated cases. By using the app, they're able to manage the case over a period of 3 days. And before they used the app, it took them 2 weeks to manage the case. So they were able to manage 152 patients when they used the app compared to 22 patients. So that shows you it's much faster, it's more efficient. Plus, because they are working together, patients are getting the best decisions. So it's not just 1 or 2 doctors making the decisions. So it's a collaborative platform. So it should also reduce medical legal risk. So that's why it's here in Malaysia that we want to help the healthcare community to provide best outcome to the patients. And lastly, you're talking about where we move forward from here. This is just the beginning. This is what I call our flagship product. We want to incorporate AI to help doctors. It's like a virtual health assistant to the healthcare community with predictive analysis and suggestions for treatment decisions.
Okay. Thank you, Ezam. And perhaps, Faris, just your own thoughts as well. From the vantage point of Xeraya Capital, you've been involved internationally. What sort of advice and lessons would you share, perhaps with aspiring founders or people who are thinking into going into health tech, from what you've seen that worked outside or elsewhere, that people can actually use as a reference point for themselves?
Hi, thanks. One is, I think for me, there could be a number of things actually, because when we look at this, we had some successes and there's some failures as well. But I guess the main one that I would probably highlight is getting back to basics. And one is, as you mentioned, what exactly are you addressing? What is the unmet need? And what is the critical problem that you're addressing? So that's one aspect of it. And the other is the value capture of it. Because it's one thing that you addressing a particular problem, but if you're unable to capture that value, whether it's patents or whether it's trade secrets and so forth, then from an investor perspective, you lose that value because it could be someone that can be replicated elsewhere. So, and it happens a lot if you don't do that. The other is when you look at the value capture, at least for I think in Malaysia, I'm quite excited actually with all these things that's happening in KL20 and so forth. In fact, last month there was a AWS Genomics Day, and I learned that actually AWS spent or will be committing $6 billion in Malaysia, which is higher than the amount that they commit in Indonesia. Indonesia is a 300 million population, and Thailand. So that's a big deal. It's a big deal, and NVIDIA also is competing. So there's all these tools that Meranti is also facilitating for shared resources in itself. So the combination of which and all these things that's happening, I think it provides great opportunities for startups that's thinking about coming out with new ideas and all that. Because otherwise, within this healthcare space, the big issue is there's just a lot of capital that's needed. When you talk about tech companies, you have a PC, 2 people and all that, and then you bring it to the next level fairly easy. But in health tech, it's just used to be very, very difficult. But now with shared resources and everything, I think it just makes it that much that much easier in that sense. But one is really trying to focus on what problem you're trying to address, the value capture. And I think the other thing is because we're located within Southeast Asia itself, I think they may need to be a bit more of how do you look at cross-border, because beyond Malaysia, which is a 30 million population, there's a 600 odd million within Southeast Asia itself. And I was quite interested to, Tom of Gobi gave that presentation at Penta Hub, right, and all this. So beyond ASEAN, there's China, India, Indonesia, and so forth. So it's really trying to think about that solution within that bigger context, because think big, and I think that makes investors excited, and you'll probably have better outcomes.
Thank you, Faris. That's an excellent sort of overview, and I think I hope it sort of gives a lot of encouragement, but also a lot of perspectives for everyone out there, because I think there's a lot that can be done. We're definitely in the right place geographically. We are also in the right place technologically, and I think it's not a surprise that we have a lot of budding startups in the health tech sector, but also a growing sort of segment that's looking at specific problems. But I think Faris's points are spot on, that you need to be addressing real problems and then try to figure out how to be able to capture that properly in delivering that solution. I think it's been of course, it's such a broad area. We can be here all morning, but unfortunately, we do have to wrap up fairly soon. But perhaps as a last round, each of the panelists, I give you about maybe 30 seconds for your concluding remarks before we wrap it up. Maybe we can go back to Tiffany.
When we really look at the opportunities here in this space, I think we cannot move away from the fact that Malaysia is so uniquely positioned with the multicultural angle. Every single time we recruit new staff to join our app, I'll give an example. We have to consider what segment of society are they from, what language do they speak, what religion do they have. And I believe strongly that if you can succeed in Malaysia, you understand the Asian community so much better than any kind of society that's a little bit more homogeneous.
Great. So I think our multiracial, multicultural base gives us a strong advantage, and that is a good concluding comment. Ezam.
I'd like to pick up on what Tiffany said. So this diverse population that we have in Malaysia is so unique for the medical field. Different genetics, different food, lifestyle, and so on. So for your genetic studies, for your personalized medicines, bring your companies here. This is the best place because the patients are there. This is Asia. You have Chinese, Indian, Malays with strong genetic differentiations. Personalized medicine is a great place to do here. So investors, solution providers should look at something like personalized medicine research here. So with MedPlanner, we are looking at doctors' conversations and AI tools in making decisions based on this different genetic pool. But genetic studies, fantastic place to do this in Malaysia.
Great, thank you. And Faris.
Yeah, I mean, for me, I'm just excited about all these things that's happening within KL20, the summit, and some events even ahead of that, because it makes a big difference because, we've been investing in, 10 years plus in this space, and there's just so many obstacles, right? There's so many obstacles, there's so many things, and that coordination is just not there. And you had various, to be fair to the previous attempts to try and get this going, it was there in terms of capital, so that's great. But I like the way that we're addressing not just capital at the right places, and the various things that's needed, talent, Even this morning I thought was quite cool, that, this single window where you founders, investors, and talent, and that's quite key in terms of, so I just probably just leave it at that.
Thank you very much. I think that is, again, a good sort of survey of the space. Again, with that, unfortunately, ladies and gentlemen, we've already exceeded by 10 minutes, but just back indulgence from the organizers. So all it leaves me to do now is actually to thank our panelists for the very interesting sort of, I would call it a survey into the space. Clearly, there's so much more that we can talk about and we can deep dive. But I think it gives you a sense of how exciting, even in this particular sort of vertical, and the opportunities that they're in. And I think with that, Ladies and gentlemen, I would like to thank again Mr. Faris Zahir from Xeraya Capital, Dr. Ezam Mat Ali from MedPlanner, and Tiffany Khoo from WeAssist. And thank you very much for your time this morning.
All right, thank you very much. And a big thank you to Ahmad Shahizam as well for the remarkable job moderating this session. And thank you to all of our participants here as well. We're going to take a 10-minute break, an eco break. And our next session will begin at 11:20 a.m. on the dot. Yeah, where we have the Chief Investment Officer of MAVCAV sharing with us more on Malaysia Venture Capital Roadmap. So stay tuned in 10 minutes time. Please be back here, or if you're comfortably seated, feel free to do so as well. You want to move up one slot, feel free to do so as well. We do have quite an array of exhibitors here if you'd like to take a look. And of course, if you've got any questions for our speakers, do take it offline as well. Approach them and grab this opportunity to ask away. We'll see you in 10 minutes time for the next session. Thank you.